Hello everyone, welcome back to our YouTube channel Dental Mnemonics, the channel where learning is smart and fun. We are again back with another exciting video, and today we are diving into the world of pharmacology. We received a special request from a student studying pharmacology asking us to simplify the classification of cephalosporin as you can see in this slide. So this video is not only about making it easy to understand, but also it is specially designed to help you tackle MCQs related to cephalosporin classifications in exam. So without further ado, let's get started. So first step is we write the initials. So we write C, E, P, H, A, L, O, S, P, O, R, I, N. And now note the bold letters which are C, L, P and R. So this stands for, like C, it stands for cefaclor and cefuroxime. L, it stands for lactam. P, it stands for pi. And R, it stands for roll. So we'll come back to all these bold letters in a moment. For now, just remember that this represents our exceptions. So next step, we again copy the word that we came up with the bold letters, cefaclor, cefuroxime, L for lactam, its full form moxalactam, pi and roll. And also note that this follows an alphabetical order. So C, E, F, A followed by C, E, F, U, then in alphabetical order comes M, then comes the P, and then comes the R. So we will discuss this in our further slide. So now let's understand the generation of cephalosporin using a simple mnemonic. So first up, discussing about first generation cephalosporin. So here's the trick. Whenever a cephalosporin starts with an CEF and is followed by a letter A, then it usually belongs to first generation cephalosporin. So all these cephazolin, cephalexin, cephalothine, cephaloridin and cephadroxil. All of them starts with an CEF and then as its continuing letter with a A. So all of this belongs to first generation cephalosporin. But medicine always has exceptions, right? And remember, those exceptions were represented by the bold letters C, L, P and R, in which the C stands for cefaclor and cefuroxime. So though cefaclor has CEF and is followed by a, but it doesn't fall in first generation cephalosporin, but it falls under second generation cephalosporin. And our other C was cefuroxime. So it also falls in the category of second generation cephalosporin. Or you can also memorize in this way, like factor FACTOR in cefaclor is spelled as FACLOR. So there is a spelling mistake, so it cannot fall in class 1 or first generation cephalosporin. So anyhow, you have to remember that the bold letters in C, it stands for cefaclor and cefuroxime, which falls on the category of second generation cephalosporin. So now let's skip second generation for a while and come to third generation. So for the third generation, remember this. The number 3 relates to 3 words. Like I and me, it makes IME. TEN also has 3 letters and ONE also has 3 letters. So the exception to this rule is, like our bold letter, we discussed about the C, the next letter was L. The L stands for lactam and its full form is moxalactam. So this says that the cephalosporin which has suffix IME, TEN and ONE belongs to third generation cephalosporin, and our exception is moxalactam, though it doesn't have the suffix IME, TEN and ONE, but it falls in third generation cephalosporin. So here are the examples of third generation cephalosporin. So first, talking about the suffix IME, cefotaxime, ceftriaxone, cefpodoxime, ceftazidime and cefexime. All of this has suffix IME and it falls in third generation. Similarly with the suffix ONE, cefoperazone and ceftriaxone, it also falls in third generation. Talking about TEN, ceftibutane also falls in third generation, and one exception is moxalactam. So I hope the third generation is also clear. Now we come to the fourth generation cephalosporin. So we know the value of pi is 3.14. So 3 plus 1 goes to 4, and the ending number of pi also ends at 4. So just remember, for 4 it's pi. Or the other way to remember this is, remember our bold letter, it was C, L, P and R, where C stands for cefaclor and cefuroxime, the L stands for lactam or moxalactam. Now comes the P, which stands for pi. So it's very easy. Whenever like cephalosporin they have the letter pi in it, it falls in fourth generation cephalosporin. So both cefepime and cefpirome, they have pi in it, so they are the example of fourth generation cephalosporin. So it's very easy, right? So now we come to fifth generation cephalosporin. So in our bold letter, the last letter was R and R stands for roll. So all that which has roll in it falls in fifth generation cephalosporin. So both ceftibiprole and ceftaroline falls in fifth generation because they have roll in it. So remember, for fourth generation it needs to have pi in it, and for fifth generation it needs to have roll in it. So now let's complete the picture by talking about the second generation. So we already know the name of two cephalosporin which falls in second generation, right? Remember our bold letter C, it stands for cefaclor and cefuroxime. Or I also said that like factor is misspelled as faclor, so it cannot fall in first generation, so it falls under second generation. So both cefaclor and cefuroxime are the category of second generation cephalosporin. So now the rest of the drugs that don't follow the rules for first, third, fourth or fifth generation automatically falls under second generation. So for example, cefoxitin, cefmetazole and cefomandole, all of this, like for first generation it doesn't have a CEF followed by a, so it cannot be first generation. For third generation it doesn't end with the suffix INBDE, IME, ONE or TEN, so it cannot fall under third generation. It doesn't have PI in it, so it cannot fall under fourth generation, and it doesn't have ROL in it, so it cannot fall in fifth generation. So it has to fall in second generation. So I hope this makes it clear. So likewise for other video, I just have a summary table. So our bold letters, it was C, L, P and R, where C stands for cefaclor and cefuroxime. So these are the exceptions, right? The bold letters are exceptions. So both the cefaclor and cefuroxime, they belong to second generation cephalosporin. Talking about L, L stands for lactam, its full form moxalactam. So like for third generation we need to have the suffix ending with IME, ONE or TEN, but this is an exception. So moxalactam, it falls on third generation cephalosporin. Talking about our third bold letter P, which stands for pi. So we know the value of pi 3.14, so ending with 4 or 3 plus 1 equals to 4, so it falls on fourth generation. So anything which has PI in it falls in fourth generation. And finally fifth generation, like our last ending bold letter was R, which stands for roll, so anything which has roll in it falls in fifth generation. So this is the overall summary for, like, whenever you need to memorize the generation of cephalosporin, then just see this table. So first generation CEF plus A except factor or faclor and cefuroxime. This is second generation. Cefaclor and cefuroxime is second generation. Rest all the CEF which stands with A falls in first generation. Talking about third generation, the one that ends with IME, ONE or TEN with 3 letters, they fall on third generation. So like here you can see IME, IME, ONE, IME. And just remember this, you can be very confused because cefuroxime, it also has a suffix IME, right? So be very careful because you might think this is a third generation, but no, it's a second generation. Because remember, for bold letter C stands for cefaclor and cefuroxime, which both are second generation cephalosporin. So be very clear in this. Now coming to fourth generation, like 3.14 ends with a 4, so anything that has a pi in it falls in 4th generation. And 5th generation ends with roll, anything that has a roll falls in 5th generation. So I hope this makes it very clear. So I have some practice questions, so let's do it together. Like, here are some groups of cephalosporin, and first I will tell the answer of which generation it belongs to, and then I will tell why it belongs to this generation. So are you ready for it? So let's do it together. So our first group of drug is cefazolin. So this has to be first generation, right? Because it begins with CEF and then is followed by A. So cefazolin has to be first generation. Okay, now cephalosporin. Now I again told you this, like this can be very confusing because it ends with the suffix IME, so you might think, okay, this is third generation cephalosporin. But remember the bold letter C, it stands for cefaclor, and cephalosporin, which is second generation. So this falls in exception, so it has to be second generation. Okay, so let's continue. So ceftazidime. So now, like, this is very easy because it ends with the suffix IME. So any suffix which ends with IME, ONE and TEN has to fall on third generation cephalosporin. So this has to be third generation cephalosporin. Okay, so now cefepime. Again, this is very easy because you can see the letter P and I in it, right? And pi is 3.14 ending with 4, or 3 plus 1 equals to 4, or our bold letter CLPR. So this has to be fourth generation cephalosporin. Okay, so let's continue. So we have ceftriaxone. Again, it has a suffix ONE. So IME, ONE and TEN has to be third generation, right? Okay, so now cefaclor. So this is the one which falls in exception. So CEF with an A, so don't be confused and think this is a first generation, or factor is misspelled as FACLOR, so it cannot fall in first generation, so this has to be second generation. Okay, so we are doing good, we are near to the end, so let's continue. Okay, now ceftaroline. So here we can see the roll, right? So whenever you see roll, it has to fall on fifth generation cephalosporin. Okay, so now this can be very tricky, like cefdinir. So here you may think that it doesn't have CEF and begins with A, so this is not first generation. It doesn't end with IME, ONE or TEN, so it cannot be third generation. It doesn't have PI in it, so it cannot be fourth generation. And it doesn't end with roll, so it cannot be fifth generation, so it has to be second generation, right? However, this is a very exception one, and like you need to make like clear in your mind that cefdinir is a third generation cephalosporin. So like I have a small trick which might be helpful. Like in third generation, we said that it has to end with IME, ONE or TEN. So just remember, like 1 and 10 is kind of like having money to get dinner. So like when it ends with like kind of a dinner, so it falls on third generation. So anyhow, this is a very like exceptional case. So this might be asked in a question like cefdinir falls in which class, and don't be confused and say it's a second generation, because it falls in third generation cephalosporin. So now we are ending with our last one, so cefotaxime. So again, this is very easy because it ends with the suffix IME, so it has to fall in third generation cephalosporin. So that's it for today, and we hope this breakdown of cephalosporin classification helps you confidently answer any related questions in your entrance exam. If you found this video helpful, don't forget to hit the like, subscribe and leave a comment with any topic you would like to cover next, anything related to medicine or dentistry. Also, the links are in the description box for our Facebook, Instagram and TikTok. So until next time, stay curious, stay smart and take care.